Floppycatters! Dr. Ruth Roberts, a leading veterinarian and holistic pet coach, has pioneered a natural approach to pet wellness. With over 30 years of experience, she's helped countless pets overcome health challenges through her innovative methods. Now she's training a network of holistic pet health coaches to spread her knowledge and help pet parents provide optimal care for their furry friends. Dr. Roberts, thank you for being here.
It is my pleasure, and thanks so much for having me, Jenny. It's awesome. And so let's see what we can
Yes,
help your floppy catters with.
thank you. So, Dr. Roberts, can I call you Dr. Ruth?
Now you can just call me Ruth. I got over the doctor stuff a while ago.
See, and that's also okay. So, one of the things when I am getting ready to interview someone is that I watch a bunch of other interviews that you've done. And I was like, I think I'm really gonna like this gal. But you don't really know until you're like, is that their stage presence person or is that, who they are? And so Dr. Ruth and I were talking beforehand and I already like her. It's cool.
Right on.
So today we are talking about kidney disease. I originally reached out wanting to talk about anything with you, and then we narrowed it down to kidney disease. And one of the reasons is because my cat Charlie is a CRF cat, chronic renal failure cat. So you've seen his blood work. We might bring it up in this, but to start out with, what are the cause? Like, why do cats get kidney disease?
I think the number one cause actually is the bag of food. We've got these beautiful desert creatures that are extremely good at maintaining hydration in that type of environment. And then we throw dry food in there and it just sucks up whatever other moisture they've got in their body. So I think that's like the worst thing we ever did to cats was a bag of food. There's a study from some time ago looking at feline lower urinary tract disease. And the reason I bring this up is it illustrates how dehydrating dry food is for kitties. So the study looked at kitties eating dry food, eating canned food, and the cats that were eating dry food drank something like 273 mLs of water a day. And you probably know the study, right? The cats eating canned food drank something like 57 mLs of water per day. But in terms of urine production, the cats eating canned food had something like 3x the urine production of cats eating dry food. And so basically, even though the kitties eating dry food were drinking a lot more water, it was basically to rehydrate the kibble, not the cat. So this is critical. I mean, if we've got a cat that is accustomed to conserving water, kidneys are the organs that seem to take the most beating when they're running around 3 to 5% dehydrated all their lives.
Yes, yes. And one of the things that I hear a lot is, my cat's on dry food, but he loves to drink water, and I'm like, yes, he
Yeah.
would love to drink it. Yes. And so for me, a cat wanting to drink water is never a good sign. Would you agree with that?
Yeah, I mean, and so, for our kitties, my own personal kitties, I started figuring this out probably, golly, it was back in 2006, and I'm like, okay. So, it was astonishing. I transitioned them from dry food onto canned food and later onto cooked food as I developed the original crockpet diet. But it was astonishing because two things happened. One is they stopped drinking water for the most part, unless it was super hot outside. And the second is that their poops got a lot softer. And I was like, hmm. So essentially, what they were able to do was hydrate themselves just by what they were eating, which is what they should do normally, right?
Yes. Yes. I also recall, so my mom's cats who are now passed, but I was very involved in their care. One got diagnosed with kidney stones at the age of 6, and
Ooh,
he was on dry and wet at that time. And that was just the beginning of me really getting an understanding of cat nutrition and stuff like that. I mean, the cat that was the reason I founded my website ate deli cat from the grocery store. It's awful.
Yum.
Um, yes, I mean, he loved it, but that's also probably why he ended up in the situation he was in later on in life. Um, so Murphy, my mom's cat, is diagnosed with kidney stones, and they tell us that he's going to need to have surgery to have them removed. And I said, is there any chance that we can just put him on wet food and see where he is in like 3 to 6 months? And they were dissolved and gone, and he never needed surgery by just getting him off the dry food. So that was my first big, like, whoa, about dry fed cats.
Right on. And so, there it is, simple science. It's if you the solution to pollution is dilution. So essentially, if we dilute out what's going through the bloodstream, what's going through the kidneys, then gradually some of these stones, sadly not all of them, can indeed dissolve both in the kidneys and in the bladder. So more
Yes.
power to you for advocating for your buddy.
Yeah, it was very cool. And then my mom was on board, which was even better since she was caretaking for them. And that's the biggest thing is the caretaker has to be the one that makes these decisions and executes on them. So I think that's important. Any other reasons where cats get kidney disease?
Yeah, I mean, there's a lot of theories. So for instance, most of the cat vaccines are grown on kidney
Kidney
cells.
cells.
So if we're following the old adage of vaccinating every year, which actually Dr. Schultz's work that came out in 94 showed us that the duration of immunity is at minimum 3 years and possibly lifetime, then that's not a good thing. I'm going to tell you that I'm not a person that advocates for no vaccinations, but for making sure that it makes sense for your cat's lifestyle. So I think annual vaccinations really are a grievous error. There's really not much use, not much reason to do that. And there's plenty of science to back that. And that's where blood samples for titers, or you as the pet parent, your cat's advocate, Googling in Kansas City, what's the incidence of rabies in cats? Or what's the
Mm,
incidence of feline upper respiratory disease or feline leukemia or any of those things? And then making a decision based on your cat's potential to be exposed. And, are they indoor, outdoor? Are you fostering kittens that are coming from humane societies that are likely to carry upper respiratory viruses, or, what exactly? So you have to really look at the risk factors and discuss that with your veterinarian.
that makes sense. I was bitten by a dog a few years ago while I was on a walk, and got the information from the owner and everything. Ended up calling the city, and because I couldn't get the medical records, they wouldn't let me get them without the owner's permission and all that sort of thing. But I was trying to see if the dog had indeed been vaccinated, and the city said, "Listen, we have not had a case of rabies for like 30 years." And I was like, "Really? Oh my goodness." Okay, so going back to vaccines and kidney cells, but what does that mean? Why is that bad, or how is that influential in kidney disease for them to be grown on kidney cells?
So with the vaccine, we're using this to ask the immune system to develop antibodies to the virus that we're desiring protection against. So if this virus is grown on kidney cells, then unfortunately during the processing of the vaccine, some of those kidney cell materials, DNA, proteins, etc., are going to come out with the protein. So the cat's immune system is also developing antibodies to the kidney cells, its own kidney cells in this situation.
Got it. Thank you.
Sure.
Okay. The other thing that I've learned, so I told you at the beginning before we were recording that Charlie is my fifth kidney cat. So typically, you're given a bag of dry food that's low in protein and whatnot for their diet. my veterinarian now doesn't do that, but the vet that we went to before would have done that or canned food with low protein. So, can you talk about what diet a kidney cat should be on? And that's not a fair question because we know that there's different stages.
Right on,
So,
right on. And so, actually, I think this might be, if you're okay, I'm going to just share these values
sure.
because 10, 20, that's one. Because I think this is a great illustration. So we're looking at Charlie's kidney values from May. So, we've got some elevations here, but Charlie's 15, right?
Yes.
Yes. So SDMA is one of the tests that's supposed to be a better predictor of early kidney disease. What many veterinarians fail to tell you is that it will also go up if there is any type of inflammation present, i.e., arthritis, inflammatory bowel disease, dermatitis, et cetera, et cetera. And then creatinine and BUN are both elevated. Um, so this is like, and there's something called the International Renal Interest Society, and they offer some staging. I think that's useful to be familiar with simply from the perspective of knowing, where how good or bad is it, and then what's the survival time. So Charlie is pushing up towards stage 3 iris disease, upper stage 2. The phosphorus level is completely normal here. For a 15-year-old cat, this would not worry me whatsoever. But for most folks, they go to the vet, the vet sees these numbers and they're like, "Oh my God, your cat has chronic kidney failure. This kitty has chronic kidney disease." And I think that's a distinction that's really important to make. And sadly, many of my colleagues don't help make that distinction. Survival time of stage 2 iris disease is over 1,100 days. So that's what, 3 years going on 4 years there. For a 15-year-old cat, that means Charlie's survival time is 19. Does that sound reasonable to you?
Yes, I'll take whatever I can get. You know that I
Right,
lost my other cat recently, so now I'm like, I'm grateful for, I've always been grateful for every day, but even more so now.
right on.
Um,
So the reason I said all of that is that it's not that you want to discount this and blow it off, but it's so that you can take a deep breath and go, okay, it's something we need to deal with, but it's not horrifying and scary. Now,
yes,
one of the things you're doing, which I think is amazing and really important for older kitties, is you're already using real food, and I think that is absolutely critical. And I think you're also already doing subcutaneous fluids, which I think for older cats that's the difference between feeling good and not feeling so good. So there's so many things we can do to support these guys that are in the earlier stages of kidney disease that will help slow things down and prevent them from actually going into kidney failure. And then
yes,
conversely, I've seen cats with the numbers that are like, holy smokes, I'm looking at them and I'm looking at the cat and I'm looking at the numbers. Cat's like, whatever.
yes,
I mean, I had a woman that she fostered kitties. They were 16, 17, 18, 19. They had horrifyingly high kidney values. They'd come in once a month. We'd do IV fluids for the day. They'd come back a couple of months later, but they all stayed eating and happy and healthy in the meantime. So the piece of paper doesn't necessarily tell us how the cat is going to do. So I think that's something else that's really important to keep in mind.
yes. And I'm really glad that you brought that up because I, with the 5 kidney cats that I've had, 3 were with our old veterinarian and 2 have been with the newer one. And I say newer one because we switched to her 4 years ago. And it's really important. It was really hard for me to break from our old vet because we had gone there for like 15 or 20 years, but I always left filled with anxiety and filled with like, oh my gosh, they're gonna die. Whereas my vet now, and I shared with you before, because you had asked, as you shared, told you what stage he's in. And I was like, no, she wouldn't do it. And she doesn't like to do that because she knows my personality and where I'm going to go with that in my head. So she always shares with it as, treat the patient and not the blood work, but don't ignore the blood work. But it's so important to have a veterinarian that is knowledgeable, but also that you feel comfortable with and that you're not left feeling anxiety. Sure, you can have some anxiety because kidney disease kind of sucks, getting that diagnosis. But she does it in a way that's like calming and here are your options. This is what we can do. And she said, Jenny, I think it might be a good idea to start consider giving him fluids twice or three times a week. And I was like, oh, okay. That's what this blood work means. And that's all I needed to know.
Right on.
So, yes.
And to your point earlier about low protein food, I think that is the most grievous thing we can do for older cats that don't have high levels of phosphorus. And the reason and Mark Kittleson wrote about this, and he is he is a boarded internal medicine specialist. But when we give kitties low protein food that are older, we're going to create muscle wasting. And in cats that actually, as they age, need higher protein diets, we're going to create malaise because they don't have enough muscle to get up and go. So I think, what I typically would say in practice and have trained the coaches to discuss with clients is that, unless there's some medical reason to drop the protein level, like the phosphorus is astronomically high, or it's worsening protein loss through the kidneys, we try to do that at the very last because two things happen. One is the muscle wasting, and then the second is the food doesn't taste very good anymore. So we can start to
Yes.
see weight loss because the cat's like, really? You're feeding me this?
Yes. I I have never ever had any success with any kidney diet ever. Like, and that's the big difference with this veterinarian too, is you end up stressing so much about them eating that kidney diet rather than the last one that I had. I was like, screw it, I don't care what you eat, just eat. Very close to the end of his life, um, and that was a relief in itself, just having him eat. So a lot of times I'm like, I don't care, just eat.
Right on.
So that's where I am. But as I told you, after Trig died, I took some time and looked at Charlie's diet and realized, okay, so I'm going to get him off of bone because that's calcium phosphate. Is that right?
Calcium and phosphorus, right? Exactly.
Yes, and get him on eggshell, so that it's calcium carbonate, right? Or pretend like I know what this is. Okay,
You
great.
do
Thanks,
know what
Doc.
it is. Yeah.
And so that simple switch made me feel better that I was giving something kidney diet-ish to him.
Right on. And that's why, but when I formulated the original crockpet diet a bunch of years ago, I used bone meal to start with. And then I'm looking at all the patients, both dogs and cats, that had early kidney disease. And I'm like, probably ought to pull the phosphorus out of there. So I ended up using calcium citrate. Calcium carbonate is completely reasonable as well. But I think that's really critical in whole food diets is to take out as much phosphorus as possible because eventually it just puts more pressure on the kidney to filter waste products.
Okay. You've mentioned your crock pet thing a couple times, but we haven't properly introduced it. So crock pet is a play on words of crock pot, correct?
Exactly.
Yes.
Yeah.
So I was actually introduced to your crock pet diet. I think a vet tech that used to work with you was interviewed by Jeff Grognet.
Could
Is
be.
that okay?
Yeah.
And
Michael
that's how
Daly.
I
Yeah.
learned about it. Yes. But will you speak to it, please, and why it came about?
Yeah. I mean, so my dog Nepenthe developed a bacterial endocarditis. And so what that means is she had an infection on her heart valve. And literally on ultrasound, this thing was this big. So huge and horrible heart murmur. She felt awful. Heart wasn't functioning well. So I did and this is when I was just starting to study traditional Chinese veterinary medicine. So got her stable, did all the Western meds, did the antibiotics, did the heart support medications, and she was alive, but not feeling real great. So I took her with me to my next training session, talked to my professors there, and they're like, okay, you need to do these acupoints and these herbs, and you need to cook for her. And like, as a veterinarian, I got to tell you, that scared the bejeebers out of me because that's like heresy. So, so we got home. This is a dog that not letting me do acupuncture. So I could do acupressure on the points. She thought the herbs were okay. She thought that the cooked food was an outstanding idea. And so I literally watched over the next 3 months as this mass on her heart valve went down to the size of a piece of paper or about 3 millimeters. Not supposed to happen in conventional medicine. She was still on some heart medication. So this was at the age of 9. She developed this thing. She died at the age of 13 after having lived a very beautiful life. Ultimately, her heart and her kidneys failed at the same time. But we had 4 years that were just wonderful and amazing. So the herbs helped. It wasn't just the herbs, and I knew that. So I'm like, okay, I got to start talking to my patients about this, my clients about this. So I started talking to them about it. I developed a rudimentary diet. We started seeing things that were just amazing. Um, and then the very first pet food recall hit in 2007. And so we just had copies of this diet printed sitting on the reception counter. And people, like, every day was a new recall, every week was a new recall. And finally, I think, Hills, anyway, that's a whole nother ugly story. But so, needless to say, over 1,000 copies of this recipe went out because people didn't know who to trust, what to trust. Some of them were my clients, some of them weren't. Some of them, they were friends of clients. But what happened afterwards was astonishing. People were like, "Oh my God, my cat doesn't have diarrhea anymore. Oh my God, the skin disease is gone. Oh my gosh." He can jump up and down on the sofa again without any problem. And so, it was like, okay, I cannot in good conscience have all of this prescription food and all this crap in my office anymore. So out it went. We started teaching home cooking. It's, the recipe itself has been through several iterations. As I grew, smarter, learned functional medicine, we changed it up a bit. But the goal was this, to give you, the pet parent, a way to make a batch of food at one time. So it's done. You freeze what you're not going to use in 3 to 4 days. So it's easy and you can do it.
Yes. I love meals in the crock pot anyway. Like it smells good in your house and yes.
Right on.
Um, so if I'm interested in checking this out, where would I get information about your crock pot?
Just go to drruthroberts.com and just
Okay.
type in the search bar the original crockpot diet and you'll find it there for sure.
Okay. Do you have a recipe for kidney disease?
I do, and we use it when we have to, but it matches all of the same nutritional profile as the prescription diets, but they do better on it because it's real food.
Yes. Yes. Yeah. And transitioning can be tough. And
It
especially when you
Yes,
haven't transitioned prior to the diagnosis of kidney disease, I
it
would think
is,
would
and I
be
think it is really hard. And so one of my own cats, Romy, who lived to be 24, um, she was the worst of all. So it took me 6 months to transition her from dry food to canned food. and then another 3 months from canned food to cooked food. So, especially with kitties, you just have to be patient. And to be fair, there are some cats that are like, ain't gonna happen. And then, then you can do some other things to try and support their hydration that way. But be super patient with your kitties because it is tough. The pet food manufacturers have the kibble sprayed with stuff to literally keep them addicted. And so it's very hard to get them transitioned sometimes.
It is. I know that this isn't about transitioning, but can you explain what you mean? I know what you mean, but I don't know if everyone listening would. How does it take 6 months?
Well, so for Romy, she's got her little bowl of dry food, and I'm literally putting a quarter teaspoon of canned food off to the side. And,
Oh, off to the
like
side.
off to the side, because when I put it in the center, she wouldn't eat. I mean, this is how difficult kitties can be. So, try
Yes.
in the center, and if the cat's like, no, there's something evil in there, then off to the side. So you have to, basically put it in a place where they can sniff at it, look at it, think about it, decide it's not evil incarnate, and go on with eating. And then move it slightly closer to the center. So literally this is why it took 6 months. So it took me 2 months to get her to actually eat the quarter teaspoon. And then from there, I could start to add more and take away the kibble. But if I went too fast, she was like, nope, deal's over. And so we're like, so just be super, super patient. And of
Yes.
course, all the rest of the cats were like, hey, what do you got there? And so that's the other thing, too. If you've got a really slow converter in a multi-cat household, you may need to set them up so that everybody else doesn't like polish off their bowl before they have a chance to get enough to eat.
Yes. Yes. Okay. Well, thank you for explaining that. And I was imagining that you probably did lots of happy dances when she finally started eating what you wanted her to. It's
Yes.
the best feeling. My cats were transitioned at 12, almost 13 to raw through Pam doing energy work, just releasing the emotions and whatnot that they had around it. And I needed it to happen that quickly. They transitioned in 2 weeks at almost 13, which is unheard of,
It is.
because Trig had all these problems with, all the gums and stuff and canned food. So we had to get him off of it and needed it to happen quickly. So, yes, if you don't have all those problems like I did, then you can do it more slowly. But it was really cool to see that happen fast for me.
That's amazing. And that's the thing. I mean, there are so many other people out there that can help you facilitate this. Like that's brilliant to use Pam Russell to do energy work to help facilitate this shift because it is there's like this is truly an addiction for kitties with the dry
Yes.
food and the
Yes.
pet food manufacturers know that they're counting on it.
Yes. Yes. It's sad. Um, so if your cat is diagnosed with kidney disease, it's usually through blood work, right? And then you also want to do a urinalysis at the same time if you can.
Right.
Any other tests that you should be doing at the vet?
I really think that that's the place to start. And like we were talking about earlier, the vast majority of cats that get diagnosed with kidney disease are getting diagnosed on routine lab work. And they are apparently healthy. They go in for their annual visit or whatever it gets called, and then boom, here are these changes on the labs. The exception to that is the cat that gets diagnosed because it's really sick. It's in the hospital because it's got vomiting and diarrhea and it's dehydrated and really shut down. And then that's where some more advanced testing is probably useful. So things like urine culture and sensitivity, abdominal ultrasounds, things of that nature can be super, super helpful.
Oh, okay. Okay. I recently had an interview with Dr. Dragos in Phoenix, and she told me that they're in I want to say that it was in Chinese medicine, but maybe she said holistic in general. There are different types of chronic kidney disease. Would you agree with that?
Yeah, absolutely. If you go through the TCVM diagnoses, there could be five or six different patterns of disharmony that would result in the equivalent of the Western diagnosis of kidney disease or kidney failure. So that's and that's a whole nother bag of wax. If you're working with a veterinarian that can support you in terms of tongue and pulse diagnosis, herb selection, that kind of stuff, that's amazing. There's some good TCVM formulas. We can take a pretty good guess at what's going on based on knowing that kitties are tend to be yin deficient, so the cooling, moisturizing aspect of life. They tend to develop kidney yin deficiency and then kidney qi or kidney yang deficiency later.
Okay. 'Cause I'd also shared with Dr. Ruth that I took Charlie in to get blood work again, maybe like 3 weeks ago now, and his alter ego Chucky appeared, and we didn't get it done. But one of the reasons that Dr. Dragos had suggested that is because I just started him on Romania 8, and she said, let's, he was, I shouldn't say just, he had been on it for 3 weeks at that point. And she said, let's see if that's working because that will help me decipher what version of kidney disease he has. And I was like, what? I've never heard of this before. But it makes sense that all kidney disease wouldn't be the same. Would you? I mean, I assume cats that you've seen
Yeah,
don't always have all the same numbers.
exactly. And again, the numbers are something that we can use to understand physiologically how the cat's doing, but it doesn't necessarily correlate to what's going on in terms of TCVM or Ayurveda or any of the other uh, disciplines, homeopathy, things like that. So I think that's where, if you can work with a practitioner, it's really important to decipher down. You can get to making an educated guess. You can get to supporting 85% of the kitties that are out there, and then the rest really do require somebody that's got those skills. Does that make sense?
Yes, yes, it does, and I think that's really important, not only for your own sanity, but just for the cat as well. Because if you go into some of these Facebook groups that are dedicated to this kind of stuff, they'll start shooting suggestions at you left and right, and you end up with a pile of supplements. And it's as I've learned through Pam and then my own muscle testing that you can't. Not every body needs the same supplement. They both might have kidney disease, but one might need Romania 8 and the other one might need omega 3s and quercetin.
Yep.
So I think that's really important. So I would be interested in what supplements you typically look at to incorporate into a kidney cat's regimen, but also then how do you find somebody that can help you?
Right on. So, like we were talking about, food is the first thing because for so many of these guys with very relatively mild elevations, simply by transitioning from dry food to real food, those numbers are going to go away. They're going to go back to normal. So I think the this is a situation where less is more, and we want to do what's necessary to affect those changes and to help bring the body back in balance, but not 17 supplements. And I saw in in my brick and mortar practice and consultations, people would come and I'm like, holy crud, what is I mean, is there food in the bowl? So there's that. So my go-tos are going to be a couple of things. One is fix the diet as quickly as we can, as quickly as the cat agrees. And then what are the things that we can add in that are going to help kidney function without, and that the cat will agree with? And I think that's the other critical thing is that many times pet owners are in a fight with their cat about getting the 17 supplements in, and the cat is like, no. So, what are the easy things? Omega-3 fatty acids, sardines in place of a supplement sometimes are a great option. And many cats are like, yes, this is an excellent idea. Some of them are like, no, I do not eat fish. So, this is where you could have an oil-based supplement if they're not fish lovers. Um, and actually, an algae-based supplement sometimes is easier than an omega-3 fish-based supplement. The other thing is making sure that the microbiome is working as best as possible. There are a plethora of probiotics out there. I really like a sporulated product by Microbiome Labs called Megaspore. And the reason is the goal is not to replace the flora, but to use organisms that, because they're sporulated, they get to the colon, and they provide the scaffolding for the rest of the microbiome to be favored, the good guys to be favored. And the reason that's important is that if the gut is working well, it is able to help reduce the nitrogenous waste workload on the kidneys. So there's the azadil, which it sounds great. I've never found it to be particularly helpful above and beyond a good quality probiotic. And then my default is quercetin. I saw that improve and stabilize creatinine values better than almost anything else. And that I ran across research a bunch of years ago looking at transplant patients on the human side that had to take cyclosporine lifelong. And the patients that took quercetin along with all of those drugs had much, much better outcomes in terms of kidney disease. Cyclosporine targets the kidney. And so the quercetin was protective in that situation. And then the other thing that can be super helpful is rhubarb root. It's not particularly tasty, so that can be a little difficult for kitties, but it does improve blood flow to the kidney and it helps to decrease the deposition of advanced glycation end products or AGEs. And these are the things that create the scarring that creates the loss of kidney function.
Got it. Well, what do you think about Romania 8?
I think that if we can get Chinese herbs in, like I would probably go with Loe de Wong or Romania 6, because it's a more basic formula. And if we're just taking a stab in the dark at herbs, I tend to go with more basic formulas.
Okay. Okay. I had written on Dr. Steve Marsden's Ask Dr. Steve's, that Facebook group. And Dr. Marsden's, the wife, replied and said that she puts all kidney cats on Romania 8. So then I muscle tested it to see, and it did swing strongly for Charlie. So that's why we started him on it. And one of the things that I also have noticed is watching him clinically after I've started a supplement to see, okay, maybe it muscle tested well, but sometimes it can muscle test well and then it doesn't do well for him and his
Yes.
body. So then I have to make the adjustment. And so I also think it's important that when you're starting supplements that you don't throw 5 together and start them that way, but start them very slowly.
Amen. And journal because it
Yes.
gets confusing, right? So write down, okay, this is what Charlie is doing during his normal day before all of this stuff started. And then supplement 1. Okay, 2 or 3 days later, better, worse, the same. And sometimes you really do have to give things longer, but usually
Yes.
within 7 days for especially for herbs that are supposed to have specific actions, you're going to see the change, or you're going to see that, oh, actually, this is kind of upsetting his tummy, or something like that.
Yes. Yes. And the journaling thing that's fascinating to me. So given that Charlie has a history of the hyperesthesia and then also Chucky at the vet, I never thought I'd be able to give him fluids. Like I was like, fat chance this is ever going to happen. Um, I had given Trig fluids during his last 2 weeks of life because he wasn't eating, and I thought I was fighting pancreatitis. So I had a refresher course very quickly on fluids after the last cat that died in 2021 that I was doing it to, and I was like, I don't know if I can do this. I don't want to get bitten. So we took him to my vet, and she ended up getting it done and rather easily with me holding him. And so I was like, I can do this. I can do this. I can do this. And we tested lactated ringers versus saline for him. As you saw in the blood work, it didn't really matter which one he got. And so what I noticed, and the biggest thing that biggest difference between Charlie and other cats I've given fluids to is after he gets fluids, he goes and crashes. Like he goes and has the best sleep of his life. Whereas I was used to kidney cats being like, game on, like I feel amazing. Um, and it wasn't bad that Charlie was going and crashing. Like it literally, like, he was belly up, like, ah.
Oh, feels so much better. Right on.
Yes.
Yeah.
So then I go to the Facebook group and just out of curiosity, I'm interested. Does anybody else have a cat that who's, kind of goes and crashes afterwards? And they're like, oh, you should, have your cat's heart checked. And I'm not dismissing that, but I'm like, no, that's not what I mean. So I think it's important to really know your cat and no,
Yes.
when they're healthy, I knew that that was a healthy reaction from him. He wasn't in distress. He was very relaxed. And like, I was like, man, I want to sleep like that, Charlie.
Yeah, no kidding. Yeah, but I mean, but you're being very observant, and I think that's super important because if you didn't know, like he's not like crashing because he feels cruddy. He's crashing because he's like, oh, thank God, I feel so much better because my fluid volume is expanded and all the yucky things are being diluted out. I think that's critical. And Dr.
Yes.
Jeff Feynman talks about beam, so behavior, sort of appetite, attitude, and how they're feeling. And I think that's a really useful thing to use too because we get like in medicine, we're so trained to look at the piece of paper, we forget to look at the cat. And because we've all been patients, us humans, we tend to think that that's how it is, and that our ability to assess how our cats feel, how our dogs feel, how our kids feel, how we all feel is different from what the doctor is going to see. So I think that's really critical to know your kitty and be really clear on, yeah, this is actually he feels amazing.
Yes. Yes. I agree. And have confidence in that. And I think the journaling helps you have the confidence because you can look back and say, oh, yeah, that's right. That did happen. So that's very important. When do you introduce phosphorus binders and which ones do you like?
So FOS binders, I mean, if we're starting to send it, it just depends, right? Because we can see kitties with phosphorus that's just at the top end of normal, but they're actually not feeling as well as they used to. So it just depends. I mean, we if they're up there and they're starting to approach the top end and they're really easy to deal with getting supplements in, then we may introduce them relatively early. So again, it's knowing your kitty, how big of a bear is this going to be to get this stuff in the cat? Because they're not particularly tasty, and it can be problematic. So certainly by the time the phosphorus is over the top end, we want to start to bring it back down towards mid-range. Um, Epichitin people like a lot. I think that's probably appropriate for towards the top end of normal, just over the top. Um, that one I've not had particular success with. The thing that people tend to default to is aluminum hydroxide. It works fairly well. It has its own set of issues in terms of there's the potential for aluminum toxicity later if the cat's going to take this for months to years. Um, I've used Savelamar, which is a prescription drug on the human side. The reason I like it is that It's kind of a smaller volume of stuff, so it's easier to get into the kitty. And then, there's a myriad of other options out there in terms of calcium carbonate, et cetera, et cetera. So you kind of did a double whammy for Charlie by switching him from a bone-based calcium supplement to calcium carbonate. Took the phosphorus out of the diet, also helps to bind up excess phosphorus. And that's where, you can use other things like, using probiotics to help reduce nitrogenous waste and fiber to help move the phosphorus through the GI tract.
Mm, I didn't know about that. Dang, Dr. Ruth. What about what is it called? Porous One? That seems to be one a lot of people like.
To be
Have you
honest,
heard
I'm
of
not
it?
familiar. I don't know that one. There's
Okay.
other things coming out like fulvic acid
Yes.
supplements that I think will be really useful for that. I mean, great general detox agents as well. I love Cellcore products for that. Their carboxy is pretty easy to introduce even to picky pets. Um, and it's nice because it's in a powder, so you can just sort of mix it into the food. Or if you have to, you can put it in a capsule and boom, down the hatch.
Yes. Um,
And yeah, so there's a bunch of stuff out there.
yes. So one of the things that I learned from your kidney disease talk with Pam Roussel was the Assisi loop. And
And I'm going
I
to
was like,
switch devices on
are you
you. Yeah,
kidding me?
yeah. And so I love Assisi loops. The downside is that they've got a certain number of uses and then they're dead and you throw them out. So I started working with a company called OmniPemf out of Slovenia. And one of my coaches actually was like, "What about this?" I'm like, "Well, I don't know." So they have something called Pets Pemf pad. The pad is rechargeable. It
Mm,
is it's nice because it has a little tiny box that you charge. Um, and then you can put the pad wherever you want. You don't have to have it attached to a cord. You tap the little box, it cuts it on. You go to your phone, you open the app, and then you tell it what you want it to do. Do you want it to work on accelerated healing, stress relief, pain relief? Or, I mean, I really like this product. And then the cool thing is that they're good for at least 2 years.
mm,
So, for a kitty, the smaller size pad, I think they're $300, 330. The large pad, which Hayo thinks is the best thing in the world, is just shy of 400. For me, it's a better quality product. And if you've got a cat that has, yes, anxiety and kidney disease, you can treat everything at one go. She has to help.
yes. But look at those ears. Those are fantastic. I was gonna say fabulous, but no, they're fantastic. Oh
Yeah,
my
she's rocking
goodness.
she's rocking the Tina Turner hairdo. So yeah, I mean
Yes.
that was huge. So with Pepe, our kitty, uh he at 14 his creatinine had crept up to about 3.6. He's like, "No, I am not eating quercetin, and no, you are not giving me fluids, and no, you are also not doing acupuncture, and no, thank you. I don't want those herbs." He thought fish oil was good. He would let me put CBD on his ears, on the
Oh,
inside of his
CBD.
ears, yeah, that's another great one too. If he was really feeling cruddy, but when he wasn't, he's like, "No." But he's like, "Yes, I'm just hanging out on the pimp mat. I'm really good." And so over months, we watched his creatinine go back down to 1.7.
That's so cool.
It
I
is very cool.
I have an Assisi loop, and have had one for years since the 2020 kidney cat. And uh, Charlie sometimes will allow it, and then other times he's like, I was, I always will put it on him while he's already sleeping, and then he'll get up if he doesn't want to have it. I actually have the Assisi Lounge, which is very similar, but
Right
you
on.
put it inside a carrier. I haven't found that they Trig too. I would just turn it on and see if they'd go to it, and they wouldn't. But if they were already on, I would put the pad down and then like put something on top of it, and if they got on it, then I would turn it on and walk away. So have you found that your cat will actively go to it if it's on?
Ye yes, he did.
Okay.
And sadly we lost Pep June of a year ago
Oh,
to
sorry.
probably he lived to be 14. He was an amazing travel cat. But he had an abdominal tumor that uh, just made it not possible for him to continue. But yeah, I
Oh,
mean, they would both go hang out on the mat. And that's kind of the other thing that I like too, is that they've got an amazing Facebook group for support. You can also create your own settings. So, like if it's too intense, they can teach you how to back the settings down so that it's tolerable.
that makes sense. Huh. Okay, CBD. This one, I'm really hoping that you will mention brands that you trust and like because I feel like it has just been inundated with CBD, meaning it being the pet industry. I can't tell
Yes,
you how
and
many
there's
emails I get.
here, try this. Yeah.
Yeah.
There's a ton of them out there. And so I think and I will tell you brands. So I do love CBD Dog Health or Hemp Dog Health. I carry that on my site. I think what's really critical is that you look for the COA. So certificate of analysis that's going to tell you that A, there's not stuff in there that shouldn't be there, and B, that it actually has what it should in terms of uh, CBD content. They do a full spectrum hemp oil, and I think that's good for GPs. And in fact, that's what we use for PEP. There are some products out there that are very high quality that do contain some isolates, so CBG, CBN, that sort of stuff, and also terpenes. And I think those can be useful in certain situations. So, for instance, for Hio, not a kitty, but she is sometimes like one. Um, she's got some really severe arthritis stuff. So we found a veterinarian in Italy that was able to prescribe THC plus CBD plus CBG plus CBN plus terpenes plus bioflavonoids, game changer.
Hmm.
So, and this is, it's not an inexpensive product. So you want to start with what you believe will work and that you can trust. So I think start with CBD Dog Health. They make cat labeled products as well, which makes us cat people feel better. In truth, this is the deal. If it has a picture of a kitty on it, you'll buy it, but it's the same hemp oil, right?
Yes.
Yeah.
Yes.
So, and I think the two crazy cat ladies love that product too. So there's that. That's a great place to start. Rooted Owl has a nice product that's really more designed for dogs, but it's interesting because it's in a sesame oil.
Mm.
And there are pets that have developed sensitivities to coconut oil and MCT oil, which is what many of the other high quality products are in as well. So there's a myriad of them out there. I think simple is a great place to start.
Okay. Okay. Oh, as far as fluids are concerned, what do you think about adding B12 to them?
I think it's a game changer.
Okay. Um,
I mean, it's like just for old cats with absolutely no abnormalities on their lab work. This sub-Q fluids once a week with a B12 injection was like, oh, thank God. It can really help them feel better.
yes. I just had a talk with Don Hamilton this week, and he asked me what was in the B12 that I was giving Charlie. And there was some ingredient that he was like, well, it's probably like a minuscule amount, but I want to say it was a metal of some sort. Is there an injectable B12 that you like?
This is the difficulty, right? Unless you get something that's compounded, it's got some sort of preservative in there. So it's usually like benzalkonium chloride. Um, And, it is what it is. And it is a small amount that we're giving these guys, so often it's good.
Yes. Just as my vet would say to me, just more for you to worry about, Jenny. Um, so then we also go to another vet who wanted to put homeopathic combinations in his fluid bag, and I was like, oh, okay. I mean, I'm usually game for anything homeopathic because I don't feel like it's really good. I'm either going to see an improvement or I'm not, but I'm not going to worry about it going the opposite direction. Um, but I don't think homeopathy is in your wheelhouse unless you've made a change. Okay.
It's not, but I did used to use Heal Products, which is homotoxicology, when I was still in brick and mortar practice. But sadly, they were pulled out of the U.S.
Mm,
some years ago.
of course they were.
Yeah.
um, and then the other thing that I put in Charlie's fluids is ozone.
hmm
Have you had any experience with that?
This started coming to the forefront, sadly, after I left brick and mortar practice, but I think it's can be an amazing game changer because it's able to get in there and help eat up some of the free radicals that are produced just in the aging process. So, have you seen benefit for Charlie?
I don't know. Um, because like when I was doing ozone on the kidney cat, his name was Camus, in 2020, like that was a game changer, and we did it rectally because he would allow that. Charlie is that is exit only.
He's like, no.
No, not gonna happen. So I I love the idea that I was giving fluids, putting the B12 in the Y line, putting the ozone in the other port, and I'm like, yes, this is like 3 for 1. So that feels good to me when I've made sure that those all work for Charlie and I've got the right amounts for Charlie's body, but also being able to knock it out in one shot is
That's
amazing.
critical. Yeah. And that's the
Yeah.
upside of sub-Q fluids is that you can add some other things in there that really help improve quality of
Yeah.
life. Yep.
Yes. But sorry to answer your question. Yes, ozone was a game changer, kept that other cat alive for 4 more months with quality of life that he didn't have before it started. So I'm a big believer in it. Okay.
Cool.
So we've got all these ideas and all these things that you can do. And then how do you,
How
who
do you
can you
do
go
it?
to?
Right.
Yes.
So if you've got veterinarians around you that can help you, that's amazing. Many folks don't. Um, and so part of what my focus in the last 2 years has been training people to be certified holistic pet health coaches. And the goal is to give them the information about nutrition, supplements, how the body works, and then options that they can help. Their job is to help you, the pet parent, advocate, has to come back and make the best possible choices for your cat so that you have knowledge. You can have much more efficient veterinary appointments because you can come in like, hey, doc, what do you think about this, this, and this? And could you do this test too? If that's, doable for your kitty. So the goal is to help you walk through what are my options, what can I do, and help you work with your veterinarian in a much more efficient manner.
Okay. So tell me more about the pet health coaches. Um, are they, you've set up this course structure or something that they've taken,
Right.
and I mean, did you cover like kidney disease, IBD? Like how is it structured?
Exactly. So it's a 14 module course, and it actually is approved for 40 continuing education credit hours for veterinarians and veterinary technicians. So
Rad.
it's not a weekend certification program, and you kind of know some stuff. Um, so they learn about TCVM, traditional Chinese veterinary medicine, functional medicine. I teach cooked food, original crock pot diet. We're bringing in some folks to help educate about raw as well, because that's an appropriate choice. Actually, for cats, they are the most appropriate species to have raw. And other folks will fight me about dogs, but that's okay. And then we teach about healing the gut, the kidneys, the liver, the bones, the joints, the brain, the immune system, cancer, all of the stuff, so that these guys are well educated. They have done myriad of video homework so that it's clear to us and their mentors that they are able to express the ideas associated and relate the content to the client clearly. And then for final examination, they have to do two recorded video consultations with real clients. So we're making sure that they know what they're doing before they get out there. And they have ongoing coaching calls with me during the program and afterwards in the Postgraduate International Holistic Pet Health Coaching Association.
Okay. That that makes me feel a lot better about it because I was wondering how do you validate what if they've learned what they've learned. Um, and also when I first found out that you were doing this, I was like, that is genius because it's so needed. And even my veterinarian, who is a beautiful soul, she does not have time to sit down and like really dig
Exactly.
deep into my cat's problems. She has so many pets to help, and as you know, there's a veterinary shortage. So I just thought it was super genius for you to do that.
Thank you. It's been the absolute thrill of my career to see what the coaches are able to do to support pet parents, dogs, cats, everybody else. I mean, it just is astonishing. And the level of difficulty some of these pets are coming to them with is just like, oh, wow. But they're just like taking a deep breath and working through it piece by piece. And I think that's really what has to happen with chronic disease.
Yes. So I assume that if I'm interested in hiring a pet health coach, I can go to your website and search there.
Click on Find a Coach. Yep.
Okay, and then how's it sorted? I assume that they can do it via Zoom. They don't need to be in your city.
Exactly. Yeah. So they can do it remotely, or if somebody is in your city, some of the coaches do work in person. Yeah. And the other thing is too, is that we've got a filter on there. So the folks that are really comfortable with working with cats, you can just click cat and those folks will come up for you.
Okay, that's cool too. Um, okay. Well, I will include a link to your website and then with the to those specific landing pages as well so that people don't have to go searching for them.
Cool.
Anything that I have not asked you about kidney disease that you wanted to cover?
We kind of danced around this to start with, but one of the most important things you can do is to remember your kitty, unless it was sick to start with, um, is still like, I'm fine. It's just that piece of paper. So, for your own comfort and your cat's comfort, start spending 3 minutes a day with them, with the phone in airplane mode, all of the devices shut off in the house, so that you just sit there, hang out with them, pet them, and two things will happen. One is that your stress level is going to come down dramatically, and you're going to go from that sympathetic fight or flight state into the parasympathetic or rest and digest state. And then the second thing that's going to happen is your cat is too.
That is great advice. I want to share this because I you just triggered my thought about it. The premix that I was using for Charlie's, the new food that I was using is Easy Complete. And the gal that created it has lots of resources on her website, and one of them is giving fluids. And so, with my anxiety of giving him fluids, I thought, I'll read again and see what else I can find. And she suggests singing to your cat when you give fluids. And I was like, well, worth a shot, man. And she said, nobody's around. Your cat doesn't care if you have a horrible voice, so why not give it a go? And it lowers your vibrational energy when you sing. So when I first did it, I sung the camp songs that my sister sings to my nephews when they go to bed because I've had to sing them. And Charlie was like, what's going on? Oh, that's kind of nice. So it really changed it. And then it allowed for it to be a bonding time rather than like a restraint crazy time. Um,
Exactly.
and thank you for bringing that up because also I felt with Camus that I got so focused on, okay, we got to do this supplement, this supplement, and then fluids here and rectal ozone there, that I forgot to enjoy what time I had left with him.
And that's, thank you, because that's the truth. We get so caught up in the disease and the diagnosis and the lab values and all of that stuff that we stop being present with the cat. And the cat's
Yes.
just like, come on, man.
Yeah. This is part of
Show
life.
show
Yeah.
me some love. I'm good. Just
Yes.
hang with me here because this is what I need from you right now. I need you to hang with me and be present.
Yes. And I've learned that from Pam that your energy and what you're putting out towards your cat, that will affect them just as much as what you're putting in their mouth. So it's really important to enjoy what you have left as well.
Amen. Cool.
Yes. Thank you.
My
I love
pleasure.
this.
It was fun. A great
Thank,
conversation.
yes, thank you for being here.